Hi, I'm Dr. Aanchal and today I'm going to tell you everything you need to know about dermarollers or microneedling. And at the end of the video, I'll tell you how you can use this safely at home. So what are dermarollers and how do they work? Dermarollers are these instruments with fine needles on them. So they make pricks on the skin. That means that it causes an injury to the skin and this stimulates collagen formation. Okay, so whenever there is an injury to the skin, there are a lot of cells that come in to heal the skin, and this can also boost up collagen. So that is how these dermarollers work. Dermaroller is a term used colloquially for any type of microneedling instrument, but I prefer to use a Dermapen over a dermaroller. I'll tell you the difference and why in a bit. The dermarollers form superficial punctures on the surface of the skin. This improves blood flow in the area, it stimulates collagen formation and improves the texture of the skin. So what type of conditions can be corrected by dermarollers? If you have superficial scars, that can also improve with dermarollers. If you have open pores, that can also show some improvement with the use of dermarollers. Or if you have fine lines and textural changes on the skin, all this can be improved with dermarollers. If you have very deep scars, then those will not improve with dermarollers. There can be an initial improvement. As soon as you use a dermaroller, you will notice an improvement even in the deep scars, and I'll tell you later why this happens. So what's the difference between a dermaroller and a dermapen? So dermarollers are these devices which have a cylindrical head, and there are multiple needles that are there present around the cylindrical head, and this kind of rolls over the skin making tears. Okay, so with a dermaroller there is a chance of causing a more superficial injury and a more unpredictable type of an injury to the skin, and it leaves a triangular injury on the skin which is wider. Okay, so compared to a dermapen, which is like a tubular structure with multiple needles at the end, so this goes to and fro making a more predictable type of an injury, also a smaller, thinner injury. So the healing with a dermapen is much better than with a dermaroller. Also, dermaroller has higher chances of causing tears on the skin. It can sometimes make your scars appear worse. Also with the dermapen, you can control the depth of penetration, and the punctures that are formed are thinner and less wide as compared to dermaroller. So the healing is better and downtime is also less. Okay, so just remember that whenever there is an injury to the skin, the edges of the wound, if they are well opposed and they are sharp, that gives the best result and the healing of this scar is the best. But if the edges of the wound are ragged, then the scar tends to be wider and not very well opposed. Okay, so that is the difference between a dermaroller and a dermapen. So it's always better to use a dermapen. How do these microneedling devices help? So basically they do make injury to the skin and cause collagen formation and collagen remodeling. But remember that we want a specific type of injury, not too deep and not too harsh. Otherwise that is going to leave behind a worse looking scar. Okay, so this is also one of the reasons why a lot of dermatologists do not recommend using these instruments at home. It has to be a very controlled injury and you must know how to do it properly in order to get the best results. So now I'm going to talk about in-clinic microneedling devices. So in the clinic we have multiple types of microneedling devices. The most commonly used is the Dermapen. So we also have microneedling radiofrequency devices which works on a similar principle, but other than just mechanical injury, it also causes heating of the skin. Okay, so this heat actually helps in better collagen remodeling, and this can also improve your deep scars. So let me know in the comments below if you want a detailed video on microneedling, radiofrequency and its uses. So how do we use these microneedling devices in the clinic? First, we assess the quality of your skin, the texture that you have on your skin, the types of scars that you have, the number of scars, the depth of scars. All these are important before we go on with a microneedling device to know what depth we want to go and how many sessions we want to take and how we want to basically plan your microneedling sessions. Okay, so all this assessment is very important before we start the procedure. So the depth of these microneedling instruments range from 0.5 to 3 mm, and we decide the depth depending upon the type of scars that you have. Decide the depth depend upon the area that we are treating. Okay, on the cheeks we go slightly deeper up to 2 mm, but on the forehead and on the temple area and the jawline area we go slightly more superficial. So it depends upon which area we are treating. This has to be customized as per your requirements and as per the type of scars and the depth of scars that you have. How often should these procedures be done? The gap between sessions ranges from 2 to 6 weeks depending upon how deep we've gone, what is the underlying condition that we are trying to treat, and also the depth of scars. Okay, so usually we wait for about 4 weeks in order to let that collagen remodeling occur, and then only repeat the next session. Initially we perform this procedure every 4 weeks, but as the scars improve and there is collagen remodeling, we can increase the gap to up to 6 and sometimes even 8 weeks. So how long does it take for you to see results? You'll be able to immediately notice improvement in your scars, but this is not long lasting. This occurs due to entry of a lot of fluid in the area, which is called edema or swelling. So whenever there's injury, a lot of fluid enters the area in order to heal the skin. Okay, so this gives that initial plumping effect and that initial improvement in all types of scars. So you might feel that this is the improvement that is going to last longer, but no, this will usually settle in about 7 days. The actual improvement occurs when there is collagen remodeling, and that you'll be able to notice not before at least 2 to 3 months. Okay, I usually tell my patients that 3 months is the time that is required for you to observe noticeable results. You need to take at least 3 to 4 sessions, and the scars will continue to improve up to 6, sometimes even 12 months after the last session. How long it will take for your scars to improve and how much your scars will improve, all of these vary between individuals and also depend upon your healing process and how much collagen your skin is able to make. Okay, so there are these variable factors that determine how your results are going to be. What is the post-procedure care that you need to take? So we recommend all our patients to properly follow a strict sun protection. Okay, you have to stay away from the sun as much as possible and use a sunscreen diligently. This is very important because when your skin is healing, it is also very sensitive to the effects of the sun and can easily darken. We don't want that, so you have to use sunscreen religiously and stay away from the sun as much as possible. You should also moisturize your skin well, so always consult your dermatologist as to what moisturizer you should use after the procedure. There are certain types of ingredients that we like to avoid and certain type of ingredients we like to include when the skin is healing. Okay, so we have to use this moisturizer at least 2 to 3 times in a day to keep your skin moist. We don't want it to dry, because whenever there's an injury and you keep the area moist, the healing is always better. You should also only use very gentle cleansers, no scrubbing, no using harsh cleansers, no using any kind of cleanser with salicylic acid or glycolic acid in them that can cause further damage to the skin. We want to be very gentle with the skin in the coming week, so a very mild cleanser and a lot of moisturizer and sunscreen is the way to go. If you are using tretinoin or a retinol, we usually tell the patients to wait for about 7 days before you start it, because tretinoin and retinol can also cause a lot of irritation to the skin, and because your barrier, the skin barrier, is damaged, so it is best to wait for about 7 days before you can resume your retinols. Now I'm going to tell you how you can safely use these devices at home. Remember that it's best to use these microneedling devices at a dermatologist clinic in a controlled environment. But because this procedure is very popular and a lot of people want to do it at home, so I'm going to tell you a few steps that you can take in order to make sure that you are getting the best results. So as you'd have already guessed by now, I am not a fan of Dermarollers. I prefer Dermapen. So if you must use something at home, it's better to use a pen or a stamp, okay, and don't go deeper than 0.5 mm because the depth changes on the curvatures of the face and you don't want to go too deep in areas and cause more scarring. So it's best to stick to 0.5 mm depth and better to use a stamp. So how will you prep your skin? First, you'll use a proper cleanser. Make sure that all bits of makeup is completely off your skin and your skin is completely clean. That is when you want to go on with a Dermapen. You can double cleanse so that you remove all the dirt and the grime that is present on your face. Don't be too harsh with the device. Be very slow when you're starting out, and you can use this only in the areas where you have the scars first. And once you get a proper hold of the device and you can control the depth that you're going in, then you can go on and treat your whole face. Remember to not apply any type of creams on your face, because a lot of these creams are not meant to be delivered under the skin. Okay, so I see these videos where they do the Dermapen device and then apply an AHA, BHA, some acid, some cream, serums, but these serums are not meant to go under the skin. This can actually cause irritation to the skin, and they are not formulated in a way that is supposed to be delivered under the skin. So whenever you use these devices, you can use mesotherapy solutions along with it, or solutions that are meant meant to be used on punctured skin. These mesotherapy solutions are made with ingredients that do not cause harm when delivered under the skin. Okay, so if you're just using any kind of creams or serums just off the rack, they can contain certain preservatives or certain ingredients that are not supposed to be delivered under the skin, and that is something you do not want. And the most important thing is to use it only once. You'll use these devices only once. Don't reuse your Dermaroller or don't use your Dermapen cartridges again, because the sterilization process might not be up to the mark. So you might want to just boil it, and that is not enough to completely clean. So if you want to do microneedling at home, it's best to use a single-use device. How often should you do it? So since you're going only at 0.5 mm depth, you can do it once or twice in a month. What precautions do you need to take? First, you'll absolutely not do it if you have active acne or if you have herpes labialis, which is like small fluid-filled blisters that you see around your lips. So if you have this condition, you'll absolutely not do the microneedling, okay? You'll do microneedling on your face only after your active acne subsides and there's only scars left. After you finish the procedure, you want to go on with a silicone-based moisturizer. Use this twice in a day in a liberal amount on your whole face. This will help in repairing the injury and also reduce any kind of environmental stressors that can make the injury worse. And like I said before, strict sun protection is very, very important to get the best results. If you do this procedure and go out in the sun, then it can lead behind dark spots, which will take a long time to get better, okay? So you don't want to do that. So strict sun protection is very, very important. So there you go, a detailed video on Dermaroller and Dermapen. I hope you found this video useful and you got to learn from it. Please remember that you always have to be very careful when you're using these devices at home. So don't reuse the device, and make sure that you consult your dermatologist and know exactly what works for your skin and use that proper device at a proper depth in order to get the best results. If you like such skin and hair related content, you can follow me on my Instagram handle Dr. Aanchal MD, where I post such skin and hair related content daily. Thank you for watching.